President of the Fiji Nursing Association, the Executive Council members, and the National Council members. I welcome each and every one of you today to the 63rd Annual General Meeting for the Fiji Nursing.
Good morning, ladies and gentlemen. I'd like to, of course, acknowledge your president, the good doctor, the roll call Tala, and all the other speakers, in particular the introduction. After listening to them all, I feel like I don't need to make a speech. But when I walked into the room, what really got to me was the color in the room. For the past 2 days, we've been in Parliament, and there's no color in Parliament. Ladies and gentlemen, I wanted to make not necessarily a long speech, but essentially to talk about some of the key challenges and issues that we face as a country, and of course then more specifically in respect of the nursing fraternity. As you know, in the past 2.5 years or so, as highlighted earlier on, excuse me, the entire world went through a phenomenal change in the way that we did business, the way we interacted, the way the medical system was challenged, the pressures, not just on the system, but on doctors and nurses and everybody linked to the health and the well-being of the citizens of the individual countries. Indeed, it became a global issue, where borders, in fact, were shut down. And in Fiji's case, of course, a country that's so heavily dependent on tourism, about 40% of our GDP is dependent on tourism, it had an enormous impact as a country. Over 100,000 people lost their jobs, almost immediately. $2 billion worth of tourism earnings that we used to get on an annual basis finished. Last year, we had 37,000 tourists, if you can classify them as tourists. In 2019, we had 897,000 tourists. So you can imagine the gap. We expect to get 447,000 tourists this year, God willing. And that'll be a jump of about 1,300% compared to last year. So you can understand and see how the dynamics have changed. Government revenue was halved overnight. So government obviously had to take some steps to ensure that a particular level of living in Fiji still continued. So we did ask people to make some sacrifices. There was no overtime paid. Nobody received overtime in the private sector. However, there was no pay cut. Absolutely none, because we continued, and we wanted to make sure that people continued to get their pay. Our wages bill, we spend about $3.6 billion a year in government. Out of this, $1.1 billion every year we pay in simply wages and salaries to all public servants. Nurses, doctors, people working in different ministries, police, military, corrections, $1.1 billion in salary. So our thinking was, we could have, as some politicians had suggested, or make a pay cut or give a pay cut of 10%. If we did do that, you would have had a pay cut. But for us, we looked at the big picture. If we cut 10% out of $1.1 billion, it would have meant taking out $110 billion from the economy. It would have made the economy even smaller. When your economy is small in the first place, it's gone small, you cannot reduce it any further. In fact, you have to grow it, so people's lifestyles can be maintained. So we had the $50 payout, we had the 2 rounds of $90, and then of course you had the now infamous $360. We paid out about $200 million, and if you add the FNPF amounts and the market vendors' fees, etc., we paid out $500 million to ordinary Fijians. About $420 million, $430 million directly in what we call unemployment benefits. Those people who lost their jobs, mainly in the hospitality sector, we said you could access your general account in FNPF. If that was finished, we paid them $225 a fortnight. Those were the type of assistance we actually did provide. With your help, of course, and there's no doubt that the nurses played a pivotal role in being the frontliners. Together with some of the other medical colleagues, we were able to vaccinate over 92% of the Fijian adult population. We had put in place various policies and measures, such as no jab, no job policy, which meant that Fiji became one of the highest rated vaccinated developing countries in the world. And the strategy was, of course, to ensure that we are able to open up the borders. Opening up of the borders, or getting vaccinated, I should say, is not only about your own health, or about your family's health, or about your community's health, or about the nation's health. It was also about how others would view us. Would they feel safe enough to come to Fiji? If they felt safe enough to come to Fiji, our tourism would actually start booming again. And that is critically important. We have, of course, other sectors that we do depend on, whether it's sugar, whether it's, forestry, fisheries, etc. But tourism is the mainstay in Fiji. As a government, over the past number of years, we've been trying to diversify our economy, get other areas to grow. There was one sector that grew, in fact, jobs. 3,000 new jobs were created in 2019, 2021. And where everywhere else, so the jobs were actually being reduced, there's one sector that grew, 3,000 new jobs. And that's in the BPO sector, business processing outsourcing, which meant people, for example, are using Fiji as a place to have call centers. It means that if I'm living in Sydney and I want to call my bank to make an inquiry about my account, when I call that number, I would not know that in fact the person answering the call is somebody sitting in Suva or Nandi or wherever else in Fiji, answering the phone call. If I'm making an insurance claim, the person filling out the form is some Fijian sitting somewhere in Fiji. There was one sector that grew tremendously. A lot of Australian companies that in fact had their business processing outsourcing in Philippines or India found it a lot better to bring it closer to home. And for them, closer to home meant Fiji. A recent study has demonstrated that we have the opportunity to grow 100 to 100,000 jobs in the next 10 years in Fiji in this sector. Digicel is being bought by Telstra. We've done our part, they're just waiting for the Papua New Guinea end of the deal to be done. Telstra is the largest telecommunications company in Australia. They also have a lot of call centers. We've already had discussions with them as to how they can bring those jobs in other countries to Fiji. It'll be a game changer. The reason why I'm highlighting all of this to you is not necessarily to give you some kind of learning experience about the economy, but also to demonstrate to you the dynamics that at play that led us to make various decisions. The pressures that we were under as a nation, where we had to be able to deal with limited resources overnight, which nobody had planned for, and how we could navigate our way through that crisis, in the same way that you have done so during this particular past 2 years. Borders have opened up, opened on the 1st of December. And this is why the revised budget that was approved by Parliament late last night, in which we announced and said, as highlighted earlier on, overtime will now be restored up to band F for nurses. As you know, that everybody else in the civil service gets paid overtime up to band E. Only nurses are the ones that get paid in from band F. So that's going to be done immediately from the next pay. Meal allowances, as you know, it used to be about $9 or $8 when we were appointed in government. We then put it up to $20. After the pandemic, of course, we reduced it from $20 to $10. In this revised budget, we've now increased it to $15. Because we do recognize with the rising price of food, etc., a lot of the takeaway outlets, etc., will put up the cost of their food. I heard McDonald's about to put up their pricing. So those of you who buy McDonald's will know the price has gone up. So the meal allowance actually will go up from $10 to $15. We've also announced that the rural and maritime allowance will come into effect immediately. I was, a few weeks ago, I was in places like Undu Point, Dongotuki in Vanuatu, in various other areas, where people do work under fairly difficult circumstances. And when I talk about difficulty, I also mean isolation. They're away from family, they're away from connectivity. And this is one of the things that we are doing. In the Northern Connectivity Project, we've connected 40 sites, schools that do not have internet. Out of the 40 sites, 12 of them are actually nursing stations. So these nurses now, and some places have doctors, but mainly nurses, can now have connectivity directly in terms of internet services. In terms of, we've given them all PCs, computers in the nursing stations. They can have a bit of telemedicine, be able to dial into Lambasa and, there's some complicated case, how they can deal with that. They've been given IP phones, which makes it somewhat easier for them to be in isolated places. I met actually when I was near Undu Point, somebody from my home village, Yavulo, who was posted up there. She'd been there for about 4 or 5 years. So these are some of the things that we're trying to do to make connectivity a lot easier, and also places like the maritime areas. Maritime areas will immediately go into effect in terms of next pay for the allowances. The rural, we're going to do a study on it very quickly, because what used to be rural now in most places or some places are in fact peri-urban now. Right, as you know, like just getting out of Suva seemed to be rural, but in fact it's no longer rural. There's a 4-lane road, there's tar seal roads, there's connectivity, there's water, there's electricity. So no longer can be caught within the rural allowance, but deep rural, yes. So those are some of the things that we've actually now implemented. The President raised the issue about some of the nurses may still not have been paid their meal allowances. That needs to be addressed. It's not a question of there being no funding. It's a question of administration. And to be frank with you, a lot of these issues are because of the failure of those people who are administering these institutions who are not doing the job on a timely basis. And that's part of the civil service reforms that we are carrying out. We also announced last night, or on Thursday evening, that we will also be carrying out a study in terms of retaining what we call scarce skill sets and also the retention issues. As highlighted in 2018 when we did the job review, I've got the salary scales here. In some of the areas, of course, the wages that went up by about 49%. If you looked at the NUO 6 in the clinical sister specialized nurse, areas such as the current NUO 5 went up. Some of the other areas, for example, the patron maternity, all department nurse practitioner, NUO 4 went up from $24,566 to $43,296. These, of course, were significant increases. And as you know, the previous way of dealing with salary increases was on a COLA basis, as opposed to recognizing specialist skill sets, as opposed to recognizing the pressure a particular nurse may be in a particular practice within the nursing area, as opposed to across the board. So I think that recognition of specialization was something that we were very keen to do so. Now we're going to do further and do an in-depth study and look at which areas actually we are losing people, well, maybe because of retention issues. And then, of course, the other issue is about the scarcity of skill sets. At one stage, we had a problem with midwives, or midwifery was very short in supply. So we need to be able to recognize that. In the same way we're doing across the board in some of the other skill sets across government. We have some very good economists, we have some climate change specialists. They're with us for 4 or 5 years, overseas training, very good at their job, and then suddenly some regional operator comes along and takes them away at 4 times the pay. We're obviously not saying we'll increase everybody's pay in that area by 4 times. But what are some of the things we can do? There is a need to recognize that there is a retention issue. So that study will be done. And as you know that our approach has always been not an antagonistic approach. The traditional approach, frankly in Fiji, from the trade union side of things, has always been a kind of acrimonious approach. Sit across the table and you have this acrimonious approach. We believe as a government that we need to be able to look at issues, take a more sophisticated, nuanced approach, and see how we can resolve issues. Because we frankly believe that civil servants need to be paid the right salary. We don't have any hesitation in that. If there's a philosophical hesitation in that, these kind of pay rise that took place in 2018 would have never happened. Because for us, service delivery is critically important. The nurses, I believe, are facing 3 new challenges, or 3 new issues they need to deal with. One is technology. The other one is, of course, the access or the expectations of the general public about customer service. Facebook nowadays is everywhere. You can be sitting there in your area of work, and some member of the public who may not be happy with you can start recording you and put it up on Facebook, maybe out of context. And the third, of course, is what we call the the venturing into the medical fraternity by private suppliers. So now in Fiji, some of you are old enough to know, 15, 20 years ago, there was no such thing as a private hospital. Everything was the public health system. Now we have private hospitals. We have, of course, the what was commonly known as Suva Private. It's now, I think, called the Pacific something. They're down the road in Amy Street. Next to it, across the street, is now Miot. They've started up their own day clinic. They're going to start one up in Nosole. They'll start one up in Nandi. They require nurses. I saw nurses. I went there to the opening. I saw nurses, some of whom used to work at across the road from Suva Private. They have now shifted across. Similarly, there'll be other people opening, so nurses will be moving around. Wages, of course, will be paid on a higher rate. This is precisely why in the budget announcement, we said we are now increasing the quota for nurses to get TELs from 100 to 350 in the new next update. And we precisely agree and absolutely agree that there is a movement of nurses. There needs to be that filtering in. And we are also looking in this review how we can in fact fund to existing nurses who may be within the system and want to upskill themselves. What can we do? You know, in the same way as we've said that the old structure within the civil service, in particular, say, Ministry of Health and Medical Services, was the doctor to reach seniority, they started administering the hospitals. That's how you got a pay rise. But one may be a good doctor, it does not mean they're a good administrator, because your training is not in that area. There are so many times we look at a health center or look at a hospital and you see 3 louver blades are missing. Or you see the place may not be cleaned well. The nurse or the doctor, they're not trained to change louver blades. No, they're trained to do the cleaning. Their job, their focus is on delivery of medical services. So we need good administrators within the system. We need to ensure that the people who are cleaning the hospitals, the people who are looking after the general maintenance, are done by professionals. This is one of the reasons, for example, why we also announced, and as you know, it will also have an impact on your profession and your workload also. And we've developed this PPP with private practitioners, general practitioners. I know some of them actually have mentioned to me that they want to hire nurses from the public health system. So now GPs, because of COVID, we said we don't want people with minor ailments queuing up at nursing stations or queuing up at Nandi Hospital or Lautoka Hospital or even CWM. They should be able to go to a private GP. I've got a headache, runny nose, I can go and see them. So they offered very basic services. A couple of injections that could be covered under the scheme. But in our recent discussions, we are now going to augment, we're going to enlarge the services these private GPs will provide. They'll be able to do urine tests, ECGs, provide nebulizers, give oxygen. So you have a holistic approach to medical care. So we really should be having what we call in overseas family doctors. When I have some minor ailment or I have a general sort of health issue, I go to my local GP. And that local GP may see me for the next 3-4 years. He or she may recognize if something dramatically has changed. Then they say, look, you need to go and see a specialist. So they have the ability to track you. You cannot do that necessarily under the current systems in the public health sector. This will mean that there'll be less people queuing up in the public health system. You need to get more of the emergency, more of the serious cases within the public health system. And that's the plan. If I go to Queensland and I've got a headache and I go to a public hospital, they'll tell me to go away. They'll tell you to go and see a local GP because they don't see those kind of cases. That's what they do. So that's just, I'm not saying you all tell everybody to go away, but what I'm saying is that we need to be able to ensure that the rationalization of services does take place. There are many parts of Fiji that have grown tremendously, but the amount of resources being put into those hospitals or health centers is still the same number, the same capacity. So a place like Nandi has grown exponentially. The major population movement just outside of Nandi coming towards Sigatoka, Malolo, Korovuto, all those Nawai Dhomba, the population has actually just ballooned out of control. It's now become a suburb of Nandi. But if you look at that place, there's no health center whatsoever. There's no private doctors there. So in the budget, we've also announced that any private doctor that wants to go to a remote place, that wants to go to Senganga, Nasarawanga, all of Raketi, we will actually help fund them to do their setup costs. So members of the public don't have to travel long distances to come and see a nurse or a doctor. And the reason why we're doing the connectivity is that we can have more telemedicine. So the face of the medical profession in Fiji is changing quite significantly, and indeed within a very short period of time. And we would like you to be our partner in this change, because in this partnership, we will be able to modernize the health system. We also expect people to think outside the box, because some people still cannot grasp the fact that I will go and see a private GP. We pay all the fees. We've had complaints about, for example, certain labs within the public health system may not be up to scratch. They're not necessarily certified up to a particular standard. And perhaps that could lead to people questioning the results that may come out. So again, we've advertised. We're looking at outsourcing that, where people who actually will run these labs will be internationally certified. In the same with biomedical equipment. I'm sure many of you have experienced this, that you may have an X-ray machine, or you may have some scanner that's broken down. Or the scanner is not operating because the air conditioning is broken down, so therefore the scanner cannot work. Or that particular equipment cannot be operated because the person who's running it, the radiographer, has migrated. There's nobody there to run it. So again, we are outsourcing that, where the providers will be given the space, they pay us rent, but they contract will say they need to ensure they not only run the machines, not only do the upgrade in the software, but they also have to make sure that the personnel who run it are there all the time. That's part of the contract. So it does not matter to us whether the person is migrated or is sick, etc. We need somebody to operate the machine. That's part of the deal. So that will help improve services. That will help make your job easier too. So ladies and gentlemen, these are some of the things, of course, that's changed dramatically. We've, of course, in the budget consultations, as highlighted, we've had members of the public complain to us about hospital services generally. I was in Solovi some weeks back, where a person stood up and said, you know, we were treated terribly by the nurse. We went there, the wheelchair was not working, the rubber around the wheel was not there, and then we had to carry the lady in my arms, take her inside, and the nurse chases away like a dog. That was his words exactly. People are a lot more articulate nowadays in terms of expectations of service delivery. Not just in the nursing fraternity or doctors, they'll talk to you about Alliance Department, talk to you about TLTB, talk to you about birth, deaths, and marriages. People now put up things in the Facebook. People come and, I've seen posts, you know, look at the state of the toilet in the bathroom, or in the hospital, sorry, or the state of the bathroom. This door is broken. This person spoke very rudely to me when I went to BDM office. We are now rolling out, as also announced, through the civil service guidelines, how to deal with customers. This is a huge psychological mind shift that needs to take place in the civil service. The nurses, I know some of the nurses we met, for example, in the Middle East, overseas. I've met Fijian nurses, for example, in the New Zealand public health system. The way they interact, I've sat there and observed them also. Once we actually had to take one of my younger son to one of the hospitals in New Zealand. The way they interacted with the patients that came along through the public health system was very different to the way we interact, or our nurses interact with Fijian patients. People walk in, yes sir, madam, how can I help you? Mr. Tongomasi, what is your problem today? How can I help you? Mr. Prasad, please wait for 5 minutes, the doctor will see you soon. He's a bit busy at the moment. That level of customer service and basic etiquette, does that exist? I'm not saying this is something peculiar only to the nursing fraternity. In other areas too. We've seen people, for example, whether it's the Alliance Department, BDM, the way that we speak to people. Today, we have one of the highest rates of education. Because of free education, we have more females now than males in high school. There are more females in university than males. hotels, toppers, free education. So people's exposure and the expectation to what public service means is much more different. And they have high levels of expectation. I go to McDonald's and they'll say to me, "Good morning, sir. Would you like a burger or a Big Mac?" Or whatever it is, a quarter pounder. People call any Fijian queuing up at McDonald's as "sir" or "madam." "Would you like anything else, sir?" And then when they go to the public health system or they go to some other government department, they just say, "What do you want?" It's true. In the same way, before, when the police officer pulled you up for speeding, they sat in the car, you have to walk to them. Very basic psychology. It does not cost a single cent. It does not cost a single cent to call somebody Mr. or Mrs. or Ms. or Sir or Madam. It does not cost a single cent. It's not something peculiar also. It's something, I should say, that doctors need to pick up too. Doctor needs to be saying, "Okay, Mr. Tongamasi, take this tablet, this is for the itch, this is for the cough. Please come back to us in 5 days' time if you're not feeling well." Basic 2 minutes, 3 minutes. We've had so many people say to us, the health facilities in Fiji aren't bad. It's just the communication that's not good. So this is a very fundamental shift that's taken place in society. And one of the guidelines that we've rolled out will be about customer service and what we can do to improve it. Ladies and gentlemen, the issues that have been highlighted by our president, of course, are some things that we're already considering in respect of what we can do in terms of retention, in terms of scarcity, in terms of also looking at the areas that need to be rewarded much better. I would again like to thank all of you for your services. It cannot be understated at all. In fact, even as much as we talk about it, it still won't be enough. We've announced that we're going to have a special plaque given to be a frontliners. We've allocated actually funding for that, something quite special. That'll be given across the board to those people who have provided the services. I wanted to highlight one point which has always been forgotten in the general discussions. It's climate change. It has an enormous impact. Enormous impact, not just on government's ability to fund, but also in your ability to be able to deliver services and what we need to do. Those of you who live in the Western Division, between Sigatoka and Nandi, there are 3 places, not because of a cyclone, but recently there's a lot of rain. And half of the highway went in Semo. Half the highway went in Nawai. Kambisi, the entire highway went, built in the 1970s. These things actually cost millions of dollars. Replacing nursing station roofs, climate proofing it. These are all, expenditures that we do not expect. When I was 7 years old, here in Sigatoka, in Matamata, 1972, during Christmas time, there was a cyclone called Hurricane Bibi. Some of you are old enough to remember that. The next time a major cyclone came after Bibi was in the early 1980s, 10 years later. Today we get 3 cyclones in one season. If we don't get a cyclone, they say, "What's wrong?" We not only get cyclones, but we get what we call inclement weather. We can get more rain in a few hours than you'd get in the entire year. During Cyclone Yasa, one of the periods, it rained 24 hours. The amount of rain that fell was the same amount of rain that London gets in 1 year. And London is one rainy place. So these actually have significant impact, not in terms of infrastructure, but your ability to have to deal with typhoid, leptospirosis, all the other diseases that actually come with it. So, ladies and gentlemen, I wanted to just highlight all those issues to you, and how these 3 key things that are changing: use of technology, what equipment you use, are we trained for that, in terms of access to technology by members of the public, in terms of the private sector moving into the health system. It's of course changing the dynamics. There is of course a huge demand also for medical professionals from overseas countries. There are recruiting agencies that come from the Middle East. I know some of them are in Al Ain, and they do a good job. They're highly sought after. A lot of people, for example, nurses lost their lives in UK. So they're in fact, recruiting people from India into UK, into the public health system. They're recruiting Filipinos. And of course, they'll be recruiting Fijians too. So the global employment market is also changing significantly. When we went out a few years ago to get specialist doctors into Fiji, and we said we need people to go to Lambasa, the question they ask you is there a theatre in Lambasa? Is there international school in Lambasa? Where can I send my kids to? Because that's how highly sought they are. So they want to look at other opportunities other than just salaries, the living conditions. So for a small country like Fiji, comparatively, we don't even have 900,000 people. I was recently in Ba, where we met with a group of people and they said, can you open up a nightclub and a cinema in Ba so we can retain people in Ba? The young people want to leave Ba. So these are the sort of changing circumstances and dynamics within society. So I think as an association, these are some of the things that you need to be cognizant of, and hopefully you can discuss in the AGM. But I really look forward to talking to you about these changing dynamics and what we can do. We need to retain you, we need to train you, we need to ensure that you have a good work environment, the living conditions that you have, your work conditions you have need to be improved. And we are, doing a lot of these things significantly. A lot of changes have taken place. Nobody expected that in the middle of Nanronga, Navosa, you'll have a hospital. Navosa Hospital. They actually have X-ray machines. They do surgeries. So the expectations, of course, have changed. The services we provide have changed. And technology has changed. So thank you very much for the invitation. I look forward to engaging with you.